Live from Phoenix, Arizona, it's the Zach Ballinger Show, where we help you find your direction through passion and purpose. My name is Zach Ballinger. I am your host. Thank you guys so much for joining us. We've got another great episode to be added to the Career Library today that will make it over 76 episodes of careers over North America where you guys can get engaged in it and learn more about that. Two ways you can engage the show. We are streaming live via YouTube. If you have questions for me and my guests, enter them into the comment box. We'll make sure to get to them. You guys know the guests coming on before the show, Zach at zachballinger.com. Email me those questions. We'll make sure to ask. Without further ado, Karese, thank you so much for joining the show today.
Thank you for having me. It's a pleasure.
Yeah, we're really excited. So tell us a little bit about your career and what you do.
So I am a myofunctional therapist, and a myofunctional therapist, because I know many people have not heard of it before, but a myofunctional therapist is very similar to a personal trainer. Only we are only working with the muscles that are below the eyes, but above the shoulders. So we're working with a lot of those orofacial and some of the oropharyngeal muscles to help strengthen and coordinate them. That helps to facilitate proper breathing, chewing, swallowing.
So it's a myofunctional therapist. And me and you were talking before the show. I have never actually heard of this career. How did you learn about this?
I learned about it through my original trade of registered dental hygiene. So I am also a licensed registered dental hygienist. And it came to me through an employer I had, a pediatric dentist who I was working for, who actually helped me learn that there's a lot that goes on here with your muscles and what's going on with the facial muscles and any sort of compensatory patternings that can alter your breathing, alter your airway, and affect your health. And so I dived right in and was able to make such an impact on my children and so many people since then.
So who would benefit from this particular therapy and work out there if somebody were listening, just out of curiosity?
Yeah. So if you find that you're having issues with clenching or grinding at night, if you are doing any sort of mouth breathing, you'll benefit tremendously. You'll hear a lot about tongue ties. People who are tied can benefit tremendously from myofunctional therapy, as well as those with sleep apnea or even ADHD. There's like a spectrum of things that we actually can help with, but those are the big ones.
Wow, that's very interesting. And so, what do you love about your job? You know, what gets you going? What are you passionate about?
I'm so passionate about helping people. It's really about getting to the root of the issues, especially when we're dealing with the upper respiratory system. There's so many ways that traditional medicine can just manage things, but then there's really like overcoming things, which is just the cherry on top of this for me.
Wow, that's so cool. And then what's some of the things that are difficult about it? So let's say somebody's out there, they've just kind of heard about this particular occupation. What's some things they should know that might be difficult for them?
Ooh. So what you should know if you're thinking about pursuing myofunctional therapy as a career is that there are certain prerequisites that you should have. So a licensure in either speech language pathology, occupational therapy, or registered dental hygiene. So that's first and foremost. You have to get all of that collegiate background information on oral health, oral development, oral function, all of that. That way you're able to really facilitate and help in an appropriate way. After that, it's its own separate continuing education, becoming a myofunctional therapist. And that in and of itself is such a rabbit hole, such a deep dive, because there's so many routes and ways you can go. Like I said, we help with the grinding and the clenching. There are people who specialize in just that, who specialize in the jaw joint and the pains in that. So it can get very technical, but it's fulfilling, beyond fulfilling.
And so is it a holistic approach to, patients, or are you doing functions and those type things? It's not your typical, like sleep apnea. I think of getting that crazy big machine to put on your face and sleeping at night, right? It's not that kind of thing.
It's not the CPAP, no. So that CPAP machine that makes you look like Bane from Batman, like it really covers that whole face, that is not myofunctional therapy. We do work with patients who are on CPAPs, and occasionally you'll get people who will wind up, no longer having sleep apnea, who will be able to come off of their CPAPs. It is a more holistic approach. It is definitely one of those approaches where we are working on function and rehabilitating what's going on with all of these orofacial muscles in order to open up that airway naturally.
Amazing. And so now, I encourage my audience, whether they're millennials or college students, is to really job shadow and, get into the field with somebody to learn and see if it's something that they would like to pursue. So let's do that in a virtual setting. So, like, if somebody wanted to wake up with you, they grab coffee and then ended their day, what would a typical day look like?
So, a typical day, especially in this post COVID world, for me, I'm doing a lot of teletherapy. So, we would be on a screen just like this if you were shadowing me at this point. A patient would log on, and typically I mail them a bag of supplies and we go through exercises. So, I try not to do any more than like 3 or 4 each time we meet. They practice those exercises for the week. And then if I see them again the following week, so if you're shadowing me for a couple of weeks, next time we see that same patient, we're going to review those exercises. We'll refine what needs to be refined. We'll change what needs to be changed, or add in something new if we need to add in something new. And we continue to follow the progress and to modify the program as need be as we go along through the day.
What did you dream about? Because you can't tell me it's a myofunctional therapist, in second or third or fourth grade. If we got in a time machine and we took you back to your past, what was your dream career?
I actually originally very much wanted to be president. I was 100% convinced that I could be president. I remember watching Bill Clinton get elected, and I was like, I want to do that. I want to be him.
Yeah, I'd say politics changes that after you watch it through years. Like, no way, I would not want that job. I'd rather be helping patients. I'm assuming that's what kind of shifted for you, right?
Exactly. And I enjoy my privacy. It's got to be tough having Secret Service behind you like all the time.
But in a way, it's kind of cool that you mentioned that, because that's a dream many kids have and to inspire to be. But if you translate it, the reason I ask that question, a lot of times I ask college kids that because sometimes we can correlate common themes throughout people's dreams and their patterns. And so something that we could even transfer to your career right now, you're helping patients live a better life. And so when we think of President of the United States at a young age, we think change, helping people, doing policies that will better people. So in a way, you can kind of extract that you took that helping sense and kind of applied it into your career now.
Yes, absolutely. Yeah, in a different facet. But yeah, I like that. That's great correlation.
Now, you mentioned, just so we get a good grasp on it, now, dental hygienist school, you kind of mentioned that was one way to get to it. Speech therapy, I guess speech, is it
Speech
therapy?
language pathology.
Okay. And so what does that look like? So let's say somebody's graduating high school and they
Mhm.
don't know anything about hygienist, how long it takes. What is the process like?
So there's always prerequisites, especially for hygiene. You're going to start off by taking a lot of your core nursing prerequisites. So if you're not familiar with those, they're mainly science-based. Anatomy and physiology, typically there's two of those. You're going to have a microbiology, you'll have a chemistry, those types of things. And then you're going to apply to hygiene school. You apply to hygiene school, super competitive. So it's very interesting because many people think of, the person who's cleaning your teeth, like, did they even have to go to college to learn how to clean teeth? But it's a highly competitive career and field where, once you're in, you've got to maintain like an over 85 average on everything. Otherwise, they'll kick you right out of the program. So you go through that whole program. It's probably about 4 years to become a registered dental hygienist in the traditional sense. If you're going to go a different route, you can do it through a community college. Perhaps you get done in about 3 years, 3.5 for most. It's going to take close to 4 years. If you're looking at speech language pathology, you should at least get your bachelor's. Many people go the route of communications, and then that would be your prerequisites. And then you're going to apply to get your master's in speech and language.
And then to get your, certification in what you're doing now, is there schools? Is there certification programs? How does one train to be that?
That is a great question. So yes, there are several organizations that offer some certifications. The International Association of Orofacial Myology, the Academy of Oral Myofunctional Therapy, the Graduate School of Behavioral Health Sciences, a lot of acronyms. There's a bunch of different places where, yes, you can take advanced training, where you can find mentors, where you can actually, dive into this field in a great way.
What kind of skills does someone need to do this type of career, you think? Whether that be, innate abilities or something you learn over time. What are the top 3 or 4?
Detail oriented is a huge one, because as we're looking at function, you've got to know that there are over 100 muscles in this area. I mean, people think of the tongue as just one muscle. The tongue is actually comprised of 8 pairs of muscles. So there's 16 muscles that are innervating the tongue. So there's an abundance of muscles here. You've got to be very focused in order to know what exactly it is needs to be the next step and what you're working on and what, comes and goes. You've got to be very patient. These things don't happen overnight. Sometimes you're working with the same client for 8 months, 12 months. Some people work a little longer. You've got to be very patient. And occasionally you're going to have to, find that in many different facets of life. But in this career particularly, patience is key. And then I would say it really, really helps to be someone who has a lot of compassion, because many of these people are going through things that you may not understand, and then you have to really dig deep to keep their motivation, because that there's something better on the other side.
Wow. Thanks for sharing that. Because that first one, you talk about, you really kind of have to have this attention to detail. Also, you kind of have to have, a scientific anatomy, right? You have to be able to pick up on that as well. And, not only learn it, but apply it to other people's lives. So thank you for walking us through that. Now, how long have you done this particular line of work?
I've been doing this for about 5 years now, and it's been so much fun the whole time. Such a great ride.
And obviously, you can't share patient names, very familiar with that process, but can you tell us a story that most impacted your life, a change story where you worked with an individual and they came in maybe even depressed over the condition? And I'm just thinking, just like your worst case scenario, and where you kind of helped change their lives.
I have one that she will always stick with me my whole life. I will probably carry her. She came to me very, very actually depressed about her situation. She had suffered loss recently of a parent, and then was going through a divorce, and at the same time had lost a job and was just stuck. Poor sleep, incredibly poor sleep. Her health was suffering as a factor of that, as a compounding effect from that. And then on top of everything, the CPAP, that Bane mask that she had to wear every night, she was just so done with everything. This was her last ditch effort to potentially get some relief, because everything else she tried didn't help very much, if at all. We worked together, and over the course of several months, I really saw that wonderful transition where there's a big correlation with how you breathe, and that's all that upper respiratory thing, and anxiety, right? So we saw a lot of that anxiety go, a lot of that depression really lift. We got her another sleep study. Her sleep study came back clean. Her health, I mean, I can't tell you, she was really like a night and day person. It went from she was always congested, she was always having issues. She had this very loud swallow that she used to talk about, where she would swallow, it would make this large gulping sound. We were able to get that to go away. So then people stopped, staring at her when she was out. It was such a night and day thing to see her become and blossom into a totally different person. She was able to actually shine through, and that will always stick with me. And I check in with her every now and then, but she's doing phenomenally. She's nothing like the person I met originally.
That's so cool, how you always remember that, yeah, mine's a little different, but in, helping people with their careers, you always remember the people that, I'll give you an example of mine. I saw a friend at a restaurant, he had moved away and he said, I just wanted to thank you for something. And I said, what? Because I didn't work directly with him. He just, watched the shows, listened to my content. And he said, because of you, I changed my line of work. And I love what I'm doing. I was miserable. And I thought that that was the only thing I could be doing is something miserable at. And then I actually went into my own career as a real estate agent. And I can't thank you enough for what you did. And so, for me, that'll always kind of be in the back of my head. We changed some directions, got, other stories where kids at colleges were, basically going to careers for the money or either going into career because their parents wanted them to do it. And then I was able to intercept them. So I know how it feels. And I can't imagine to do it at your level where you're actually helping people's health. That's a lot bigger of a deal than, because you have to first have your health to be alive to change, habits. So I appreciate you sharing that. Now, how do they find you? Because I imagine not every doctor would refer or even know, they would think you use a pharmaceutical approach. Maybe I guess it depends on kind of what doctor you talk to, but how do they get in touch with you?
I would say that there is a large shift in the health paradigm where people are actually advocating for themselves. People are actually looking for alternatives. When they go for those alternatives, I am mostly referral based. So I do get a lot of referrals from the naturopaths, from the holistic doctors, from even some health coaches where they know that this is a different modality. This is something that will help their patients in a natural way of achieving this upper respiratory health. Then there's the people who do advocate for themselves, who are constantly looking for a solution. They're going hard on Google and PubMed and trying to find any answer they can. And they will stumble across myofunctional therapy. It's very well researched, especially if you're on PubMed. And then they start looking for a myofunctional therapist. And I do have a very good SEO or whatever you want to call that. So I do have people who just find me. They're like, oh, I was Googling, I found you. But mostly referral based.
And so let's say somebody's out there listening, they either want to know more about your career, they want to connect with you. Share with us your website, your social media links, whatever you got going on.
Absolutely. Thank you. So I have my own private practice, the Myo Spot. And on my website, it is themyospot.com. So www.themyospot.com. You can find me in my private practice. I do have a scheduling link on the website. And so if you do want to talk to me about myofunctional therapy or starting a career in it, feel free to reach out, schedule an appointment there for a consultation, and we'll talk about it. Because cost absolutely nothing. If you're looking to learn significantly more, I am also on the board of the International Association of Airway Hygienists. And that is a fantastic organization that is really pushing and making strides to make this a better known field so that, it won't be the first time that everybody hears it. And that you can reach out to them on myiaah.org, myiaah.org. Those are the two best places from my website and that website, but you can also connect with me on social media. I'm on Instagram and on Facebook. Both are at the Myo Spot.
So and they can find your social media too on your website, I'm sure, right?
Absolutely. All sorts of links.
And guys, what we'll do, me or Karese will either put it into the comments below the video about her business and her social media. So if you guys want to follow her on Facebook or Instagram, those are her two biggest channels. You're welcome to follow her on there, as well as check out her website. You never know who might be listening. So if you got a family member that you think could benefit from this and they've never heard of it, especially, I haven't even heard of it. And like I said, I work with a lot of careers. So, check it out and send her. And like she said, the first consultation to kind of talk to you about it is no obligation and free of charge, kind of working through that and see and how many need. And Karese, I would imagine it depends on the patient, what they're going through, how long, because I'm sure that's one of the questions out there. How long does this take? How many sessions? That's probably patient dependent, my guess, correct?
Absolutely. Everybody's different. We all present differently. We all have different structural issues that we might have to overcome. And so absolutely, I would say that that's definitely going to depend on what you present with.
Okay. So we did have a couple of questions that come in. I wanted to get to them before we know you're very busy. So the first question that comes in, it says, you said that dental school was very competitive. Does that mean a GPA and you have to take a certain exam, or what did you mean by competitive?
GPA, yes, it is very competitive. So there's usually not many spots available, but lots of people who apply. And that's what I mean by competitive. And so your GPA, your test scores, like what's going on, that's going to be a big factor in whether or not you get accepted. There are plenty of people who have to try more than once or try various schools in order to get accepted into one. It is highly competitive as a field.
And then another question that comes in, do most speech therapists get a master's degree?
Yes, most of them do.
Yeah, that's what I thought. So you usually, and there might be programs out there with 4 years, but I'm sure that there's to get in the field if you want to. I'm sure there's a certification. You do need to have a master's at that level, is my guess.
Yes, it's pretty much master's, like entry level almost. It's very, very well, I don't know, it's very well taught at that level. And so if you're looking to, charge out for insurances and, be a provider that's going to be accepted by the insurances, you should get your master's.
And the last question is, do you help hard of hearing patients, especially with, it says something about they know it's in the ears, but do you help as far as anything to do with hearing loss?
I do not help with hearing loss. However, when we have those patients who have those frequent ear infections, when you're not swallowing appropriately, there are definitely going to be deficiencies in your clearance for the ear. And so, that's where I could help out, not necessarily hearing loss. That would be more a speech language pathologist with a focus on more the hearing than the speech.
Awesome. Karese, this has been so helpful. I'm so happy to have you a part of the career library. I think it's going to shine a light a little bit more even into this field. And it's really exciting anytime we can add careers to it, and especially ones that are a little unique and maybe somebody hasn't heard of before. And you definitely sound really passionate about your expertise. So we do really appreciate you coming on the show.
Thank you. I appreciated being here. Thank you so much for having me. It was an absolute pleasure.
And like I said, guys, we're going to enter in all those into the comment box in one way or the other. You'll see that on all of my social media links. And so you guys will now have another episode of the Career Library. So with that, take care. I hope you guys have a great week. Until the next Career Library, have a great one.